Thank you for joining us.
Oh, thank you very much.
Okay. Uh, Today we'd like to talk about some special areas in cardiology treatment. So we heard about trans-aortic valve implantation, and you are quite expert in this field. So can you please tell us something about this?
Yes, so this is a procedure called TAVI, for short, TAVI, or transcatheter aortic valve implantation. And this is a procedure where we are able to replace the aortic valve without the need for open heart surgery. And it is done on a beating heart through a small hole in the groin. So basically, it's a minimally invasive way of replacing the aortic valve, which has come about in the last 10 years or so.
So can it be performed in radial way?
No. So as we know it right now, most of the angioplasties or balloons and stents in the heart
Yeah.
arteries are done through the radial artery. That is possible because the equipment for heart angioplasty and ballooning is really miniaturized,
Okay.
and the tubes are about 2 mm in diameter. For TAVI, because we have to compress the valve down to a small diameter and put it through a tube, it is still a relatively large size tube, and that's about maybe 5 to 6 mm, and therefore it is not possible to do through the radial artery. And the only way we can do it is through the femoral artery in the groin.
Okay. So is it also suitable for the pediatric cases?
Uh, so this the most of the patients with aortic valve stenosis are actually all very elderly patients due to valve degeneration or wear and tear. And in the pediatric group where you have congenital aortic stenosis, actually number one, that's quite rare, and number two, they actually do quite well with balloon valvuloplasty or repair. And we do not at this time extend this therapy down to a very young patient like this group of patients. So most of our patients nowadays are patients who are in their 70s or maybe even 80s,
Okay.
and some patients in the 60s who have multiple comorbidities or disease processes that make them at high risk for conventional open surgery.
Okay. So the patients are not suitable for open surgery.
Yes.
They are the ideal case for this.
Not just that, the scientific data actually has evolved a lot since I first started this technology in 2009. Initially, we were doing patients at high risk or not suitable or inoperable for open heart surgery. But the scientific research, the data has come out showing that this therapy is actually equal or superior to surgery in not only those two group of patients, but also in patients who are intermediate or medium risk for surgery. So the studies are now ongoing for patients at low risk for surgery, but we do not have the answer yet.
Okay. So you have been in Bangladesh for quite a long time.
Multiple times.
Yeah, multiple times. So you know
Lost count.
our services. So it has improved over the last couple of years tremendously in comparison to other disciplines of in medicine. So how do you compare the treatment provided here in comparison to here?
So I think if you look at something like heart angioplasty, which
Yeah.
is a common procedure, I think that is roughly the same in most places. Okay, for the standard or the simpler cases. The reason is because it's easy to set up what we call a cardiac catheterization lab with the X-ray machine, and the equipment is, like I mentioned, they are all now so miniaturized that it's easy to stock the equipment. But I think for the extremely complex cases like chronically occluded arteries, or patients with previous bypass graft and have now run into the graft becoming narrowed or blocked, then those patients are actually higher risk, and they may benefit from a place like Singapore, which we have, I guess, that a bigger range of equipment, better setup, and better support services. Because sometimes it's not just the procedure, but the aftercare, including the nursing staff and paramedical staff.
Okay. So often we hear about the application of stem cell therapy in different areas. So, what are the particular areas where stem cell can benefit the patients in cardiology?
Yeah, I think in cardiology, the main area where stem cell has been been investigated for the last, I think, 10, 15 years is in patients with very bad heart failure, where the heart has been badly damaged through a previous heart attack. But so far, I must say the scientific results are at best a little mixed. Some studies show some improvement, some not, and it hasn't been all that promising at this stage. I think a few recent studies do show some improvement, but we really have to wait for longer term follow-up and results to know if this is truly a way we can help our patients with these very bad hearts.
Okay. So if we go back to TEVI, why this is not introduced in many countries like coronary angioplasty?
Okay. So I think first of all, the number of patients who have aortic valve narrowing is much less than patients with heart artery narrowing or coronary artery disease. Because coronary artery disease is actually a very common problem. We have so many patients with diabetes, high blood pressure, high cholesterol who smoke, and they end up with a high risk of having heart artery disease. Whereas the aortic valve narrowing is due to a process of wear and tear or degeneration, and therefore the number of patients are less. And as with any procedure, you need a high volume to gain experience and be good at it. And if you have only a small number of patients, then it becomes quite obvious that only a few centers or big centers will be able to do the procedure, get enough experience, and do it safely for our patients.
Uh, any general advice for the cardiology patient?
I think at the end, cardiology is about trying. Of course, we fix the end part of the disease, but a lot of times many things can be prevented or at least minimized early on. And I would say to most patients, that really the important thing that one needs to do is to control your risk factors, to screen for diabetes, high blood pressure, cholesterol, don't smoke. And these are the things that will avoid you a lot of pain in the subsequent years, because otherwise we come in and sometimes we have a difficult time trying to fix very heavily blocked, heavily calcified arteries.
Okay. Thank you, Doctor.
Thank you so much.